In this video, we'll answer the following questions. How can you tell if your blood vessels need cleansing? Is it possible to remove cholesterol plaques without medication? Which foods actually improve vascular health, and which ones, on the contrary, contribute to blockages? What preventive measures can help keep your blood vessels clean and elastic for years to come? As we age, our blood vessels inevitably wear out, lose elasticity, and can become clogged. But the good news is that you can improve their condition without resorting to drastic measures. In this video, we'll break down the most effective ways to cleanse your blood vessels and reduce the risk of heart attacks and strokes. How do blood clots and plaques form? Blood vessels are the body's transportation system. Arteries carry oxygen and nutrients to the organs, while veins return blood back to the heart. However, over time, blood vessel walls can become damaged and less elastic. Cholesterol and calcium may start to build up, forming atherosclerotic plaques. This narrows the vessels, restricting blood flow and forcing the heart to work harder. Blood clots, thrombi, are another serious risk. These are clumps of blood that can form at sites of vessel damage or due to blood clotting disorders. If a clot blocks a blood vessel, it can lead to a heart attack, stroke, or pulmonary embolism. Floating clots are particularly dangerous because they can break loose and block critical blood vessels. It's important to understand that vascular blockages start long before any symptoms appear. Many people don't realize they have a problem until their arteries are already 50 to 70% blocked. To determine what exactly you need to do, we first need to examine the main causes of vascular issues. Poor diet. An excess of trans fats, sugar, and processed foods accelerates plaque formation. Foods high in cholesterol and saturated fats, such as fast food, processed meats, sweets, and baked goods, contribute to harmful lipid buildup in the blood. They increase levels of bad cholesterol, LDL, which deposits on blood vessel walls. On the other hand, healthy fats help remove bad cholesterol. Monounsaturated and polyunsaturated fats, found in avocados, olive oil, and fish, support vascular health. Lack of physical activity. A sedentary lifestyle slows blood circulation and causes stagnation, increasing the risk of clot formation. Regular physical activity improves circulation, strengthens vessel walls, and lowers cholesterol levels. Smoking and alcohol. Nicotine causes blood vessels to constrict and raises blood pressure, while ethanol damages artery walls, making them more vulnerable to plaque buildup. Additionally, smoking oxidizes cholesterol, making it even more dangerous and more likely to accumulate in blood vessels. Alcohol, in small amounts, such as a glass of red wine, may have antioxidant effects. However, frequent alcohol consumption damages the vascular system. Chronic stress. Constant stress triggers the release of adrenaline and cortisol, which negatively affect blood vessel tone and promote inflammation. This raises blood pressure and accelerates arterial wear and tear. Hormonal imbalances. Estrogen deficiency in women during menopause, thyroid disorders, and vitamin B deficiencies can all negatively impact vascular health. Women are naturally more protected from atherosclerosis at a young age, but after menopause, their risks become similar to men's. Inflammatory processes. Chronic infections, including gum disease and cavities, can damage blood vessel walls and contribute to plaque formation. Studies show that people with chronic periodontal disease have a higher risk of cardiovascular problems. Dehydration. Not drinking enough water increases blood viscosity, raising the risk of clot formation. For proper circulation, the body needs at least 1.5 to 2 liters of clean water daily. Excess weight. Obesity puts additional strain on blood vessels, triggers inflammation, and raises cholesterol levels. Excess weight is also linked to insulin resistance, which negatively affects vascular health. Genetic predisposition. If your close relatives have had vascular problems, your risk of atherosclerosis is higher. However, even with a genetic predisposition, a healthy lifestyle can significantly reduce the chances of developing the disease. Now, let's move on to the most effective methods for cleansing blood vessels. Stay tuned. Nutrition. Green tea. Rich in antioxidants, especially catechins, which slow down cholesterol oxidation and prevent plaque formation. It also improves endothelial function and helps arteries dilate, reducing blood pressure. Garlic and ginger contain compounds that thin the blood and lower bad cholesterol, LDL, improving blood circulation. Garlic also has antibacterial properties and can reduce inflammation in blood vessel walls, while ginger supports circulation and lowers the risk of clot formation. Oatmeal and buckwheat contain beta-glucans and fiber, which bind excess cholesterol in the intestines and help remove it from the body. Regular consumption of these grains stabilizes blood sugar levels, which is also essential for vascular health. Omega-3 fatty acids, fish, flaxseed oil, walnuts, improve vascular elasticity, prevent clot formation, and have powerful anti-inflammatory properties. Regular intake of fatty fish reduces the risk of heart attacks and strokes. Nuts and avocados, rich in healthy monounsaturated fats, which reduce inflammation and strengthen blood vessel walls. Nuts also contain arginine, an amino acid that enhances circulation and reduces stress on the heart. Seaweed, kelp, a natural source of iodine, supporting thyroid health and regulating lipid metabolism. It also contains alginates, which help remove heavy metal salts from the body, reducing oxidative stress in blood vessels. Berries, blueberries, cranberries, pomegranate, packed with polyphenols that protect blood vessels from inflammation and lower cholesterol oxidation. Pomegranate enhances artery elasticity and reduces blood pressure. Physical activity. Vascular pump exercise, a movement routine that strengthens blood vessel walls and improves the response to pressure changes. It involves dynamic leg movements that enhance venous return and circulation. Daily walking. Moving for just 5 minutes every hour improves circulation by 45%, preventing stagnation. A 30 to 40-minute brisk walk daily reduces the risk of cardiovascular disease by 30%. Contrast showers. Alternating between hot and cold water trains blood vessels, improving their ability to constrict and dilate, if no contraindications exist. This enhances capillary tone, reduces inflammation, and aids in detoxification through the skin. Stretching and yoga. Flexibility exercises help relieve stress and improve blood circulation. Yoga also lowers blood pressure, supports nervous system function, and alleviates vascular spasms. Neck exercises. Specific movements prevent carotid artery stenosis, ensuring proper blood flow to the brain. Gentle neck tilts, rotations, and massages reduce dizziness, improve brain circulation, and ease shoulder tension. Swimming reduces joint strain, strengthens the heart, and engages all muscle groups. It is particularly beneficial for people with excess weight or joint issues. Breathing exercises, deep breathing techniques, such as the Buteyko method or pranayama, enhance blood oxygenation, lower blood pressure, and stabilize heart rhythm. Traditional remedies. Elixir of youth, a mix of buckwheat, garlic, and kefir, strengthens blood vessels and lowers cholesterol. Buckwheat is rich in rutin, which fortifies capillaries, while kefir promotes gut microbiome health, essential for overall well-being. Raisin water, an infusion that helps remove excess lipids and supports cardiovascular health. Raisins are rich in potassium and magnesium, essential for heart rhythm regulation. Black pepper plus turmeric. This combination enhances antioxidant and anti-inflammatory effects. Turmeric contains curcumin, which reduces vascular inflammation and prevents cholesterol buildup. Garlic infusion improves artery elasticity, helping to prevent atherosclerosis. It also normalizes blood pressure and promotes blood thinning. Chamomile tea reduces vascular inflammation and relaxes arterial smooth muscles. Chamomile also helps manage stress, benefiting the nervous system. Hawthorn tincture strengthens the heart and blood vessels, helps normalize blood pressure, and reduces heart rate irregularities. Ginkgo biloba enhances microcirculation, increases brain oxygenation, and lowers stroke risk. It is often used to prevent age-related vascular issues. Ginger tea with lemon supports blood thinning, improves circulation, and boosts immunity. Lemon provides vitamin C, which protects blood vessels from damage. Rosehip infusion, high in vitamin C, strengthens blood vessel walls, improves circulation, and helps lower cholesterol levels. These methods help maintain vascular health, but it's essential to consult a doctor before starting any treatment or preventive measures. Maintaining vascular health? A comprehensive approach. Following a holistic approach, balanced nutrition, physical activity, and a proper daily routine ensures long-term vascular protection and reduces the risk of serious diseases. When should you see a doctor? Shortness of breath, chest pain, weakness could indicate heart problems, including ischemic heart disease. If chest pain is accompanied by tightness, burning, or radiates to the left arm or shoulder blade, it may signal angina or even a heart attack. Call emergency services immediately. Dizziness, vision problems may indicate insufficient blood supply to the brain, possibly due to atherosclerosis in the neck or brain arteries, increasing the risk of a stroke. If you experience double vision, lack of coordination, or sudden weakness on one side of the body, seek medical attention immediately. Cold extremities could be a sign of peripheral artery disease, PAD, where leg arteries become blocked. Symptoms include numbness, pale skin, and pain when walking. Without treatment, this condition may lead to tissue necrosis and even amputation. Frequent headaches, memory issues may be symptoms of cerebrovascular insufficiency. Atherosclerotic plaques in brain vessels impair blood supply, leading to cognitive decline, poor concentration, and even dementia. If you experience frequent morning headaches, check your cholesterol levels and get an ultrasound of your blood vessels. High cholesterol levels require medical intervention. If your cholesterol exceeds the normal range, it's crucial to adjust your diet, increase physical activity, and consult a doctor about possible medication options. Calf pain when walking suggests impaired blood circulation in the legs, which, if untreated, may lead to gangrene. This could indicate peripheral artery disease or deep vein thrombosis. If pain worsens with movement and subsides at rest, seek an angiologist or vascular surgeon. High blood pressure. If your blood pressure consistently exceeds 140 over 90 millimeters of mercury, your blood vessels are under excessive strain, accelerating wear and tear. Hypertension is a major risk factor for heart attacks and strokes. Sudden speech impairment or limb weakness, a warning sign of stroke. If someone suddenly struggles to form a coherent sentence, experiences numbness on one side of the face or body, time is critical. Call emergency services immediately. If you experience any of these symptoms, don't delay seeking medical help. The sooner treatment begins, the higher the chances of preserving health and preventing serious complications. Self-medicating can be dangerous. Our blood vessels are the foundation of life, and their condition directly impacts our overall health. It is possible to cleanse them, but a comprehensive approach is crucial. Proper nutrition, physical activity, and risk factor control. There's no magic pill, but there are proven methods that truly work. Share in the comments, what methods do you use to maintain vascular health? Don't forget to subscribe, and turn on notifications to stay updated on new health tips. Take care of yourself.